Okay, hello, hello, hello. What is up, guys, and welcome. Um, uh, Hi, hi, hi. Just want to make sure y'all are hearing me. Hello. Hi, hi, hi. Just want. Okay. Um. uh. Nobody is in yet. United in love, Jesus is for us. We shall conquer. Covenant children, united in love. Jesus is for us. We shall. Oh, who asked me to sit on the floor? And I cannot start moving. Hallelujah. Hallelujah. Life moves faster Hallelujah. Recently. Send money quickly with Remitly. Download the app today. Oh, come on. Come on, guys. Come on. Sorry for being late. Mm, yeah, what was I going to do? Okay, let's do this. Somebody came in and left. That's not how they do life. Okay, so if you're seeing me for the very first time, hi. Thank you for joining. Um, I'm going to paste a link in the comment section if you just want, if you have a question regarding a CBT, I want to come up, let's talk about it. Fine. Feel free to click on the link and let's talk. So while we wait for people, we're just going to go ahead to do what we are here for, which is live demonstration of your CBT practice test. So I'm going to do Pearson Vue. That's what we'll tap on our browser. Pearson Vue practice test. Bixby, go on vibration mode. Got it. I set your device to vibrate. Thank you. Okay. Right. Please let me know if you can see the screen right now. Okay. So we click on. Unfortunately, I can't see the comments while I do this, so I may have to be checking my phone to see if there's any comments. Okay, no comments yet. So this is, you know, everything that you'll be seeing. Of course, we'll be doing. I don't know. Should I do that for midwifery as well? Do we think I need to do that of midwifery? I mean, I'm not a midwife, but I have a basic knowledge about midwifery, and we've done all with adult nurse. We've done that's like videos that I've put out, not live demonstration. We've done mental health numeracy, except clinical. So let us start. I don't know. Let us start with adult numeracy just to refresh our minds. Just to refresh our minds. Let me put this phone here so that I can see what I'm doing. Yep. So once you click on, this is what you'll see. Wait, why is this? I'm so sorry. So this is what you'll see. You know, it contains 15 questions, and it's just to get you accustomed to the style of the question, level of difficulty of the questions, format of questions and answers, buttons on the screen, the timer, screen out, everything. When I wrote mine and I passed at first trial. When I wrote my exam, guys, I had Royal Martin. I had a lot of books for um, this CBT, but to be honest, I didn't really study them much because when books are sort of too much for me, sometimes it makes me feel overwhelmed. So I basically did not. I won't say I studied any of those books if I'm being honest. So most of my practice was with this website and an app, and I shared with us the questions on that app. You can see it in a video. I think it's the second video, so it's a bit long. When entering when entering numeric numbers, only include significant digits. Do not add extra zeros after the decimal point unless the answer requires them. Never forget that. For example, if an answer is 1.5 and needs to be entered to one decimal place, do not enter 1.50 or 1.500 as this may be shown as incorrect on the review screen. So if you're just joining, you are welcome. Oh my god, I almost choked on that. Okay, we're back. Some questions require you to enter a number and a unit. Always use the standard scientific abbreviation for the units, such as kg, milligram, L, or milliliter. Do not add S after the unit. Do not write out the full name of the unit. Do not add any additional text, such as the name of the medicine. This will cause the item to be marked as incorrect. For example, we have 5 ml of water, 5 milliliters, 5 mils, 5 ml. Do not do all those things. Do not bother doing all those things. And you have 30 minutes for this whole question, and you have 15 questions, which is a lot of time. A lot of time. Okay, let's go to the question now. What is the volume that has been drawn up in the syringe? Please use the correct unit and answer to one decimal place. So in this kind of place, what you have to do is to look at where your number one starts from. So this is where our number one starts from. How many line is it from one? It is two, with the third one being one. So that means this is zero, this is 0.5, this is one, this is 1.5, this is two, and so on. This is 5, this is 5.5, this is 6, this is 6.5, which brings our answer to 6.5. So the question also says, please use the correct unit and write your answer to one decimal place. So I am writing 6.5 with no additional zero, N in small letter and L in capital. Next. So we are going to apply similar method to this question. It says, what is the volume that has been dispensed? Please use the correct unit. This one is already standing on its own, which is 20 ml. It is 20 ml. So we're just gonna go ahead and put 20 ml. See how I put that in? That's how it's supposed to be. Then next. Come on. Why is the internet delaying? Okay, number three is here. A patient has been prescribed 2 liters of 0.9% sodium chloride. What is the volume in ml? Now, this is conversion of units. How many mil makes up a unit? I mean, how many milliliters makes up a liter? 1000 milliliter makes up a liter, and we have 2 liters. That is 1000 multiplied by 2. So we have our calculator here. Do not forget. I feel like in the videos I'm like rushing because of YouTube algorithm. The video has to be sharp and all, but I like these live sessions. And maybe we'll do the rest in live sessions. Maybe. We got 2000. So I'm just gonna go ahead and put a 2000. You don't need to put a comma in there. Anything that is different from your specific numbers, please don't put it. And since we've been given our units, you don't need to put in the units. So we're just gonna go ahead and press next. Please also take note of your time. You are given a time here which says we have used about 4 minutes. Let me just say 4 minutes to answer 3 questions, which is good because a question is 2 minutes because you need it for the ending. So a patient has been prescribed 0.6 gram of ibuprofen. What is the dose in milligram? If you don't know what makes milligram, gram, milliliter, liter, if you don't know all those change of unit stuff, I would advise that you learn them. You can go online and search, basic units conversions and memorize them. So it's similar to the one that we did earlier. 1000 milligram gives us 1 gram. And now we have 0.6 gram. So I know the answer already, but let me just make it brief for us. So if 1 gram equals 1000 milligram, then 0.6 milligram is what? X. So, you cross multiply. Unfortunately, there's no how I can. I don't. Is there how I can do it here? Let me see if there's a way I can do. Um. Oh no, it's asking me to pay, and honestly, I can't pay anything. Okay, we have 1 gram equals 1000. 0.6 equals x. So 1 times x, 0.6 times 1000. Then you make x subject of the formula, which gives us 0 0.6 multiplied by 1000. So our answer should be 600. Yeah, 600 milligram. If you are unsure, please leave your question in the comment section. I'm checking the comments. Nobody has commented yet. Okay. All right. A patient has been prescribed 3 milligram of phenytoin. How how many tablets should be administered? We have that one tablet is 100 milligram, and the person has been prescribed 300 milligram of phenytoin. So what do we do? It's basic division. 3 milligram, 300 milligram divided by 100 milligram. Since one tablet is 100 milligram, that means we are given how many? Three tablets. You just need to put three. You don't need to stress it at all. Okay. Now we've got another question here that says, a patient has been prescribed 1 gram of carbocysteine solution. What is carbocysteine used for? Carbocysteine is, I feel like sometimes knowing what each medication is used for will help you with, will give you an idea of how to answer the question sometimes, most especially in your clinical aspect of CBT. So carbocysteine is used for clearing of throat, like people who have phlegm accumulation in their throat. So they are prescribed carbocysteine. So it helps with the expulsion of phlegm. Now they said that this person is prescribed 1 gram. So what volume should be administered? We have here that the medication comes in 200 milligram in 5 mil. So if 200 milligram is in 5 mil, 1000 milligram will be in what? 200 equals 5. 1000 equals x. 1000 multiplied by 5. X multiplied by 200. And that gives us what? 5000. I mean, 200x equals to 5000. I just hope I'm not making things worse. So um 5,200 equals 5,000, and then we have to make x the subject of the formula. 200x equals 5,000, so we have to make x the subject of the formula. That means we have to divide 5,000 by 200. It's really hard to explain that. I thought it would be easier, but it's hard to explain it without like a note or something to draw on. So our answer is 25. And as you can see, the question says, please use the correct unit because we are not given any unit here. So we have to use 25 ml. M in small letter, L in capital letter. Okay. Any question? No question. Why are you guys not asking questions now? Okay. A patient has been prescribed 100 milligram of phenytoin suspension. I thought we did this earlier. What volume should be prescribed? Should be administered, sorry. Please use the correct unit. Okay. This person is prescribed. Oh my god, this this light is giving it's making me feel so warm. Just excuse me for a minute. Okay. I'm back. Did you miss me? Because I missed you. Okay. A patient has been prescribed 100 milligram of phenytoin solution. What volume should be administered? Please use the correct unit. So phenytoin comes in 250 milligram in 5 ml, and we are to give 100 milligram. So the first thing I would do is to divide both sides by 5. That would give that would make 50 milligram in 1 ml, and we are to give 100. So how many 50 milligram will make 100 milligram? 2. So that means we are giving 2 ml. I know some people are not that good in maths, but I hope I am able to explain better to your understanding. A patient has been prescribed levetiracetam. Oh God, levetiracetam suspension at a dose of 10 milligram per kilogram. The patient weighs 70 kilogram. So this patient is supposed to take 10 milligram per each kilogram. So since the patient is weighing 70 kilogram, that means the patient will take 70 milligram times, 10 milligrams times 70, making 700 milligram. Yeah, milligrams. And then we have that this suspension comes in 100 milligram for 1 meal, and we are supposed to give 700 milligrams. So all we have to do is to give what? 7 ml. And I had something in mind to give the first person that joins also. Okay. A patient has been prescribed 60 milligram of flupentazole decanoate. What volume should be drawn up for the injection? Please use the correct unit. Okay, the person is to take 60 milligram, and we have 20 milligram in 1 meal. 22 times 3 is 6. And we are given 60, right? So you are going to carry the 60 milligram, divide it by 20. It gives you what? 0 cancels 0. How many 2 will you see in 6? 3. So that means we are given 3 ml. Don't forget, when the question says to use the correct unit, that means you must put in your unit. Some people make these silly mistakes and it costs them money, because if you fail, you have to pay to rewrite. Oh my god. Just a minute, guys. Just a minute. Okay. A patient has been prescribed 4 milligram of diamorphine hydrochloride. I think diamorphine is mostly for like painkillers and all those kind of like end of life medication. So, what volume should be drawn up for the injection? Please use the correct unit and answer. Please use the correct unit and write your answer. Please use the correct unit and write your answer to one decimal place. Okay, so the patient is to take 5 milligram in 1 meal, which is one. I mean, the patient is to take 4 milligram, which is uh, the prescribed dose, but this medication comes 5 milligram in 1 meal. So what do we do? 5 equals to 1, 4 equals to x. 5 times 1, no, 4 times 1, 5 times x. What I'm basically doing is cross multiplication. Since 5 equals 1 mil, 4 milligrams equals x. 5 times x, 5x equals 4 times 1, which is equals to 5. So to get x, you have to divide 4 by 5. So 4 divided by 5, 0.8. And our answer says to write it to one decimal place. So we're going to give 0.8 ml. Hope you understand. A patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilogram. The patient weighs 90 kilogram. So what this is saying is that we are to give this medication based on the patient's weight, and we have the patient's weight to be 90. So what we have to do is to multiply the dosage by the weight, and the weight is 90 kilograms. Then multiply, 90 kilograms, then multiplied by 0.5, which should give us 45. Wait, what's happening? Yeah, 45. So, um, What volume should be drawn for the injection? Please use the correct unit and write your answer to one decimal place. Just to save us the hassle of all those previous explanation, your prescribed dose divided by um, medication dosage, like now 45 divided by 50, that's what will give you the amount to give. So 45 divided by 50, 0.9 ml. So this is basically fluid infusion rate. Please, as you're doing this, take note of your time. We have less than 10 minutes to finish paper one. So you have a table of fluid infusion prescription, and it says at what rate would you set the infusion pump to run, and we have our units to be in mil per hour. So we are given 400 volume, which is here, to run for 5 hours. Just ignore the time because there's nothing for us to write regarding that. So all we have to do is to carry this 400 and divide it by 5. You are my everything. That is 80 ml per hour. Oh, you see, I forgot. I wanted to put in the units, but it told me not to. So please make conscious effort not to make that mistake as well. Uh, So I'm just going to do the same thing. This one says to give our answer to the nearest whole number. This means that we're going to get decimals, but we should give our answer to the nearest whole numbers. So that is 1000 divided by 6. So that's 166.66666. Since it says to the nearest whole number, that will mean 6 will become 1, and we add it to this 6 and it becomes 167. So that's 167 mil per hour. Okay, we are just going to do the same thing with this one as well. We're already given the units, ml per hour, so it just wants to calculate the volume divided by the duration. So that is 800 mil divided by 5 hours. That is 160 ml per hour. Okay, so let's go to the next question. This is the last phase where you do a fluid balance chart. Complete the fluid balance chart to calculate if the patient has gained or lost fluid over a 24-hour period. If the patient has gained fluid, you should include plus before your answer, e.g. plus 100 ml. If the patient has lost fluid, you should include minus before your balance answer, e.g. minus 100 ml. Please use the correct unit. So please don't bother reading all the patient information. Just go straight to input everything in oral and intravenous. Just add them up together. I like my simple trick is to calculate how many 125 is here. One, two, three, four, five, and six, which should be 450. Well, let's see. 125 times 6. Oh, 750. I didn't calculate that well. Uh, we have 100 twice, which is plus 200, and then we have 150 twice, which is plus 300. So that gives us 1250. Just come down here in the total input and put your total input, which is 1250 ml. You don't need to put the units. Now you come to the total output as well and you do the same thing. So this is 310 plus, I'm going to take it from downwards, 200 plus 80 plus 180 plus 140 plus, oh, that's all. Oh my god, what's wrong with me? Are we supposed to leave that place blank or we're supposed to put something? Anyway, now that we've gotten our total input and total output, remove output from total input. That's 1250 minus 910, which is 340. So the person obviously gained fluid. So we're just going to put plus 340 ml. And I think that's it. I just hope they don't penalize for this because I'm not sure if it's supposed to be with or without. I'll just put it anyway. And that is it, guys. We got everything correctly. And we still have 4 minutes left, 4 minutes, 9 seconds. So you can see that it is very, very easy. Oh, I've got one comment. Samuel, these questions are quite simple. Is that all that is needed to pass numeracy? I saw some complex questions online. Please don't trust any of those complex questions that you saw online. I'm so sorry, I'm just seeing this your message. Uh Please don't trust any of those complex questions online. I did the same thing. I was in your shoe at one point, and I remember I was so scared when I saw those questions. But it's all a lie. You won't need such in your calculation. That is just for the calculation anyway. We are going to do the clinical aspect. And as I said earlier, it was quite easy for me to pass with studying on these questions that I saw on this app. But if you want, you can go ahead and study. If you want, you can go ahead and study um, Royal Math Center's book. But please don't really depend on anything outside of what NMC provided for practice questions. So um, I made a video that is not on this Pearson Vue. Uh, like You see, anything that I made a video on, like adult nursing, let me use for example now, especially adult nursing. I don't know what you are. I did adult nursing. So I made a video from an app that I saw, and I think it's like 120 questions. Out of the questions on that app, I think I saw over 50% in the exam. And I practiced with that app. And some are in your personal practice questions already. So once you practice with all those, you are good to go. You are good to go. Oh, you're welcome. So we have already spent 40 minutes just for one distance. So let us go ahead and do let us go ahead and do the um, clinical aspect. It's actually funny because you said these questions are simple, but people still feel it. People, I'm not mocking them, but people still feel it. Yeah, yeah. So, you know, we give glory to God for where we are and whatever situation that we may be facing. Okay, so let's move to the other one. And I've been checking the comments so that I won't miss. Okay. Clinical practice for adult nursing. Okay, this is a practice test for adult nurse clinical. This practice test contains 50 questions. Use it to become familiar with the various features of the CBT, the style of the questions, the level of difficulty of the questions, format of questions and answer, the buttons on this, all those things we talked about basically. So here you have 75 minutes to answer 50 questions. That means each question is like 1.25 minutes, if I'm right. So over here we have a calculator, which I don't really think we will need. And then we have an objective. So this is like a sort of like hint to why the question is being asked. Then don't forget to flag for review if you're unsure. Then your time. Okay, so question one says, but beyond just answering these questions and memorizing the answer, it's for you to understand the question because I know there were some questions that are like similar to the ones on this practice test, but they twisted it in some ways. So if I had memorized the answer back then, I would probably have chosen the wrong answer instead rather than understanding the question in order to answer it the right way. And in fact, it's not pride, but I didn't really study too hard for this exam. But when I started hearing people saying they were failing the exam, I was like, what? This is not meant to be. So, which is why I started like putting out those clinical practice videos. But after we're through with everything now, Seth, I don't even know what else I'm going to do. What else am I going to do, guys? So, I don't know. Is anybody still okay? We have few people still watching. All right. So, which of the following question which of the following describes a quantitative method of research? Now, what do we mean by quantitative? That means something that can be measured given a number. So, the first option says exploring a phenomenon by interviewing participants. Um, Second option says collecting people's views and opinions. Third option says reviewing published research, and fourth option says collection of numerical data. Remember what I said, where it can be quantified. Views and opinions cannot be quantified. So our most suitable answer is collection of numerical data. Let's check the objective. It says demonstrate an understanding of research methods. Da, 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 da. So let's go to the next one. Choose the four themes of the NMC's the code. Choose the correct answer. It's This is something that you should have at the back of your palm. That is the four C's of NMC. So it says here to prioritize people, practice effectively, preserve safety, promote professionalism and trust. If you are planning to come to the UK, then oh my god, I think I'm not. Am I sharing this screen? Wait a minute. Okay, I'm sharing the screen. All right. Prioritize people, practice effectively. No, no, no. Yeah. So you should have this at the back of your palm at all time. When caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. They are not to receive blood or blood products, they are not to be sedated, they are not to be resuscitated, they are to be cared for by professionals who are JW. We know that they are not to receive blood or blood products. You may be asking, why is this important? Because as a nurse, you need to respect your patients. Just like our previous question that says, prioritize people, prioritize their needs, prioritize what they want, prioritize their religion. Yeah, it's not what you feel that should matter. It's what they feel. Although you have to let them know, like, okay, this is what is going to happen. So, should I go live again tomorrow to talk so that we talk about something else? Please comment, let me know. Um, when caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. Lest I forget, please try to make a research of some common instruments that are used in the UK and what they are used for. You may get questions regarding this in your exam as well. I remember I saw one that is used to measure like um, lung expansivity or something. What is it called? I think it's called Spiro something. I can't remember. Anyway, let's go on. Hopefully, I see it here. So the first option here says use a face-to-face or online translator. Find the information you need from medical notes. Ask a family member to translate. Ask the patient to draw pictures. So the first thing is it's a no to the family members because yes, they may be related, but your patient still has a right to their privacy. And worst case scenario, probably a husband is HIV positive but does not want the wife to know. You can't ask the wife to come and translate for you. So our best option here is to use a face-to-face or online translator. So some people have like nurses who are bilingual or polyglot that understand different languages that may be able to um, translate for you. When a drug error occurs and the patient has been assessed for any harm, what is the next priority? Um, I think that the priorities would have been to inform the doctor, but I'm thinking that is already covered under being assessed for any harm. So we'll just go ahead and choose inform the patient of what has happened. Hopefully this is right. Or is it called patient's family? No, you need to inform the patient first. Okay, HPV. Excuse me. HPV. Um, HPV is from. Is it ovarian or cervical? Oh, I am really doubting between these two, but I am so sure it should be cervical. So the ones that I'm not sure of, I'm going to flag them for review. Hi, if you're just joining us, you're welcome. Don't forget to like, comment, share, and subscribe. Don't forget to leave your questions in the comments as well. Okay, which of the following professions are specifically trained in smoking cessation? Now, when I first saw this question, I was thinking it's probably a hypnotherapist, but I was wrong. It's not a dietitian because that's not what they do. It's not a chiropractor because they deal with bones, or is it chiropractor? So it's a pharmacist because there are some pharmaceutical medications that help to control nicotine addiction. So it's definitely a pharmacist. Okay. Um, Which of the following diseases is notifiable to Public Health England? Choose the correct answer. So basically, what this is saying is like, excuse me. Basically, what this is saying is like, all those. Let me use like COVID kind of disease. So people have people could have mumps, people could have HPV. So our answer is most likely between C. diff and influenza. I'm sorry, I should have studied before I did this. But yeah, I was banking on residual knowledge. So I am going to go with C. diff for this because C. diff is a very serious disease or infection. Disease, it's not an infection. Which of the following is a health visitor's responsibility? Choose the correct answer. So, what is a health visitor? They are people that come to like assess and all this kind of thing. So, our option here says giving first aid and treatment in crisis, supporting the physical and emotional growth of a child, assessing speech and language. So, it should be to administer immunizations. I just hope I'm right, but that's what I would go for in this. What are the common complications of uncontrolled blood sugar levels in diabetic patients? So what this is say, so what this is saying is like um basically like all those diseases that could occur from uncontrolled blood sugar, which is which can be retinopathy, um, the peripheral vascular disease, renal failure. Let me just be sure there's no other one that looks much good. Yeah, I'll go with that one. So we have 39 more questions to go. A doctor requests a lactic a doctor requests a lactate test to be taken from an unwell patient. What type of sample should what type of sample should Oh god, I should have worn my glasses. What type of sample is taken? Choose the correct answer. So, sample for blood gas. Oh, sorry, I said lactate. I said I already said the answer. So the sample uh for lactic test is usually blood gas, or some people would say either full blood count. Hmm, no question yet. Sample for lactate. Is it blood gas or full blood count? I think I will go with the blood gas. Yeah. Sorry, I'm getting a bit distracted. Scale 2 on the News 2 chart is used for which patient group? So the News 2, I already made a video on this thing. So it's like something that is used to monitor oxygen levels. So it can be said for those that have been exposed, no, not carbon monoxide. So it's for those with dioxide retaining, carbon dioxide retaining patients. Patients with chronic pain conditions are screened for which of the following? Choose the correct answer. We know that chronic pain comes from cancerous things. Can coronary heart disease cause chronic pain? I think that should be chest pain. Okay, come on. Which of the following groups has the highest rate of suicide? It's definitely men. You don't need to like argue it too much. It is men. A patient presents with productive cough, low saturations, high respiration rate, raised lactate with news 2 of 9. What does this indicate? It indicates, wait, productive cough, high respiration rates. Definitely indicates chest sepsis. Prior to surgery, oral fluids are withheld for 2 hours. I think it's 2 hours here. Yeah, it's 2 hours here, but in Nigeria, it's like 24 hours. I think 24 hours here, but here it's like 2 hours. Me that I don't drink fluid anything like that anyway. What group of drugs are used in patient controlled analgesia? Patient controlled. Oh, okay, like controlled medications. So that would definitely be opioids. So, so this is what I'm saying. Like, some of these terms can be very confusing. Like now they are saying here like pressure control. So what they are typically saying is like controlled medications used for pain pain relief. So our answer is opioids. Patients who are put on furosemide are warned of which common side effect? So what is another name for furosemide? It is late cyst, and we know that late cyst causes increased, you know, is it the glomerular filtration, increasing urine output, and here we have constipation, polyuria, oliguria, diarrhea. This is scanty urine. This is a lot of poo. This is our answer, polyuria. I'm being mindful of the time so we don't run out of time. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? This is back slap. This is the patient's back. You've given the back slaps. This is the patient's back, and you've given this back slaps. So after this is done and it is unsuccessful, what is the next thing you do? You chest, I mean, abdominal thrusts. You give 5 abdominal thrusts. So let me just reshare this screen back. So you give 5 abdominal thrusts. You are caring for a patient who has stomach formation and they are ready for discharge. What advice do you give the patient? Use perfumed. So we know what stoma is, right? Like people who, excuse me, have um like people with probably cancer or something, and they had to like open their intestine on their abdomen. So that is where poo comes from. So um So, what do we advise these people? To use perfumed soaps to aid odor control, clean with water, trying to keep fecal fluid away from skin to minimize the wait until bag is before changing it with soapy water. Keep the area moist when changing. No, no. So our answer should be to clean with water. I've trying to keep fecal fluid away from the skin to minimize irritation. Because once they clean and fecal fluid is not on the skin, then there's no way they would be irritated. But something in me is like probably to use perfume soaps as well. But then if they clean it properly, I don't think there should be odor. But perfume soaps, no, I would say to clean with water. So next question says, what is the responsibility of an occupational therapist? What is the work of an occupational therapist? Can you guys see me very well? Okay, so what is the responsibility of an occupational therapist? Choose the correct answer. Um, A. Supporting people whose health may prevent them from completing their normal activity. Reviewing and adjusting prescribed medications. No. Assessing someone's ability to see. No. Assessing injury or damage in a patient. No. So the first option is our answer, which is to support people whose health may prevent them from completing their normal activity. Whose role is it to lobby to the government to support nurses and to make positive change to the profession and working conditions? Choose the correct answer. Um, this question is kind of tricky. So, if you are just practicing for yourself, please do not. Let me probably just put the link in the comment section for people who may want to practice for themselves. Please do not feel bad if you feel like you didn't do well the first time. I think the first time I did mine, I got like 12. Like the first ever time I practiced by myself, I did like 12. I got like 12, but then I had to read and all. So for this question, I think would go with the individual teams of nurses. Some people may want to say the nursing unions, but I would go with the individual teams of nurses. So we have 28 questions more with 52 minutes left. What does it mean to performance manage an employee? So this term performance manage, it simply means like you know, if you're an immigrant nurse now, they want to see it's not like you're not good. Although people here although people here may think that you don't know what you are doing, but it's not that you don't know what you are doing. It's just that the way things are done here is different from how it is done in Nigeria. And they are too wise to know that. So the process of trying to know what you know in order to know where to help you to adjust is what is called performance manage. It can also be called personal improvement plan. So option says developing a person to fulfill the expectations of their role. Um, when performant, no. When a person is promoted, when no. So the first option is our answer. One other option, one little trick that I use if you are not too sure is to check the options and see those that are like similar thing. Just try to look at the one that looks a bit odd and think very well. It may be the right answer. It's a trick that I use sometimes when I'm not too sure of which is the answer. When running a ward or unit, which of the following is the priority at the start of the shift? Choose the correct answer. A. Make sure a doctor is on the ward. No. Check the staff numbers match patient acuity. I think so. Calling and updating family or carers. No. Yeah. Check the staff numbers match patient acuity. You need to make sure that the number of staff on duty is enough to care for the patients. Each wards or hospitals have like their range, like okay, four patients to one person, even though it's not possible. Most hospitals, I think they do like six patients to one person. If it is care home, you'll probably be having 20 patients for one person, although you have your carers, but you as a nurse, it will be just you. So let's go to the next question. When supervising a student nurse, when do you deliver feedback? Choose the correct answer. So feedback is supposed to be given immediately when it's needed. Like go and give, go and do this. The student nurse did it and they did it well. Well done. If they didn't do it well, oh, you didn't do this well, immediately, so that it sticks there. So let's look through the options. A, feedback is provided by the university. No. B, at the end of the placement. No. C, at the midpoint and end of a placement. No. D, continuously throughout the placement. Exactly. What is a whistleblowing policy? So whistleblowing is like you worked somewhere and they are doing things that are not ethical, and you want to like do amicable to like you know let it out, but without putting yourself in trouble. So the policy is like emergency. No. A policy that helps employers manage staff. No. A government-led policy that advises trust and care. No. A policy that guides staff on raising concerns about safety and practice. I am so sure of that one. When undertaking research, what is the first step? This question is very simple. When you are doing research, the first thing you need to do, of course, is to have your topic, like know what you want to talk about. So option A says collecting data. No. Um, B is selecting the topic, which I will choose. C, applying for ethical approval. No. D, recruiting a team of people to help you. No. Uh, what is the main purpose of a root cause analysis? Choose the correct answer. Uh, for people who are watching, are we all going for adult nursing? Because I would prefer to do something that we are doing instead of something that we are not. Maybe if you are not doing adult nursing, I should probably just switch to what you are doing. Because I have a few, we've done the numeracy part of mental health, and and I've got a few comments asking for the clinical part, but I've not been too good in health. That's why I've not been able to do it. Okay, let's go on. So root cause analysis is like what um what could have caused this thing. Let's say a tree keeps drying off. Well, it's because the tree is completely covered, it's not receiving sun, it's not receiving water. But you are trying so hard to um you know save the tree without knowing that, oh, it's because it's not receiving water and sunlight. So you are just wasting your time. So that's basically what root cause analysis is. So what we have to do is to identify the cause of the problem and manage it. So our option says to identify who was responsible for the incident and performance manage them. B says to assess those who were involved. Those involved require compensation. Let me take that again. To assess if those involved require compensation. C, to ensure that reoccurrence is avoided. To provide data. mm, I would choose to ensure that reoccurrence is avoided based on the analogy that I just gave. Who will notify the who will notify an emergency department that a major external incident has occurred? So this should be done by the nurse in charge. This should be done by the nurse in charge, not the reception, not the hospital press. It should be done by the nurse in charge. When noticing that a colleague is suffering from low mood and depression, what actions should be taken? Uh, this is something that is very big in your OSCE, like the practical aspect. I want to start making videos on OSCE, but I'm a bit scared so that I won't be judged because I had a bit of issues with my OSCE, not because I didn't know them. There were personal issues, so I had to write my OSCE a few times. But yeah, so just let me know. So to this question, before you go ahead and report or do this or do that, you need to speak with the person first. But let me see what our options are. To refer them to occupational health without discussion, no. Provide support and guide them to well-being services, yes. You can see how the options are like inform their manager without telling the colleague. No, 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 you don't do that. Unfortunately, that is what happens, but you are not supposed to do that. You're not. Don't forget, if you have personal questions or something, you can leave them in the comments or my Instagram. And we have a WhatsApp channel. Check the channel description. You will see the link to join the WhatsApp channel where I drop links. Oh, that reminds me, I've not dropped the link to this video. What has been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions? Choose the correct answer. Preceptorship trainings, ensuring students have maths, no. New pre-registration education requirement, no. I think that should be the new pre-registration education standards. No, that should be preceptorship trainings, but I'm not too sure if it should be that or new pre-registration education standards. But let's click on the next question. Who is in attendance at a child protection case conference? Choose the correct answer. A says all those who are so a child protection case conference is like when there's a hearing, probably when they feel like a parent is not good enough to train their own children, or they feel like the child is unsafe for the parent. So that is when this kind of meeting is done. So A says all those who are involved with the family from all those who are involved with the family from health, education, and social services. A, social services only. B, the team supporting the parents and carer. I think it should be all those involved. I'm not too sure, but I think it should be all those involved because I've never gone to such meetings and I don't pray to go. What documents could help a nurse understand the preferences of a patient with dementia? Like what would help you to know a patient better? And it is a "this is me" document because it's like telling you everything you need to know about the patient: their name, their date of birth, their age, their preferred name to be called, their preferences like color, food, everything. So unfortunately, not everywhere has this document, but yeah, it is a "this is me" document, not the handover sheet or not the patient's drug chart, not the recent discharge summary. Who should be notified when a child? Who should be notified when attending hospital with a child aged 8? Choose the correct answer. I think this should be the school teacher. It should be the school teacher. Or is it the school nurse? Oh Lord. School teacher. It should be the school teacher. There is a requirement to increase nursing staff on a ward due to an increase in patient demand. What steps are taken? Choose correct. What steps are taken? Choose the correct answer. If you guys, oh sorry, I thought I could receive gifts. Uh, there is a requirement to increase nursing staff on a ward due to an increase in patient demand. What steps are taken? Choose the correct answer. We currently have 4 people watching and we only have 2 likes. Please give the video a thumbs up. God bless you as you do so. Option A says ask the team to increase their working hours. That is not an option. Option B says Option B says to reduce the number of patients admitted to the ward. No. Option C says go directly to human resources and ask them to recruit. And option D says a business case. Sorry, I'm getting a call. And option D says a business case is of, oh my god, it's showing here. And option D says a business case is written to increase the number of nursing. Just a minute. Okay, sorry about that. A business case is written to increase the nursing staff. So we'll go with D because I believe not everybody can just go to the HR to ask for increments and stuff. So when failing a student for professional values, what steps are taken before the end of the placement? Choose the correct answer. A, you inform your line manager so they can inform the student. B, no steps required as long as the fail is documented. C, contact the university and get them to inform the student they have failed the placement. D, a midpoint interview where you are able to give feedback and allow the student to develop an action plan to achieve. Yeah, this is the right way, which is similar to the previous way where you give feedback at every midpoint. Which of the following is a framework used to identify areas for development? I think they should be what? I don't know what it means. Don't ask me, guys. According to Rogers' theory of nursing, um, which of the following are described as core conditions to effective communications? Which of the following are described as core conditions to effective? Choose the correct answer. So that should be congruence, empathy, and respect. Wait, what does congruence means again? Let me quickly search my dictionary. Congruence, it means agreeing or corresponding. No, no, no. Our answer should be empathy, respect, and honesty. I'm not sure about that congruence. A motivational interview is described as is best described as choose the correct answer to complete the sentence. A method used to encourage people to adhere to discharge advice. Um, a tool used in peer supervision, no. A tool used in appraising staff for development. A method of assisting people with behavior change. That should be a method to assist. I mean, a method to like assist people to change. A tool used for appraising staff for development. Oh God, why am I so split with this too? Or is it because I'm getting hungry? Uh, anyway, we have 10 more questions to go, and the ones that we may get wrongly, we can easily like review them and change them to choose a correct answer. So, what is the best method of delivering advice to patients with a new diagnosis on a long-term condition? Okay, advise the patients to look up any question. No, this says give all the information all at once. Ensure there is a range of materials available and present for the patient to take home after the I'll choose C. I would choose C. What does ANTT means? It means antiseptic non-touch technique. No, it means aseptic non-touch technique. Aerosol. That's like where like bodily fluid is generated. So which of these could be brushing teeth, administering oral medication, blood transfusion? This has to do with bodily fluid. This has to do with fluid. This has to do with fluid. I'll probably just go with this, but I'm not too sure, honestly. Let us flag for review. A wheeze is commonly heard on auscultation. We all know what auscultation is, right? Like to hear breath sounds with stethoscope. Wheeze can wheeze is usually for asthma now. Definitely not plural. I feel plural pulmonary edema. It should be for asthma. Hematemesis simply means what? Hem, that's blood. Emesis is vomit. Emesis. It should be vomit, not stool. When caring for a patient at the end of life, we we people in Nigeria, we don't know how people that are like dying are really cared for here. It's not like we don't care for them in Nigeria, but the way they do as if they are eggs to the extent that sometimes I'm always scared for someone to die during my shift because sometimes it may be like uh, the person is not supposed to die or the person died a painful death, and they'll start questioning a lot of things. And I've seen where people like had to be interviewed by police after someone died. So ever since that, I have been praying to God that I don't want any issue. And thankfully, I've not had any issue with my end of life patients. So, when caring for patients at the end of life, a family reports that they are concerned that the patient is suffering from dehydration. What action is taken? Now, people on this end of life, most times, like when it's like you don't give fluid anymore, you don't give fluid anymore, you don't like give food, you hardly give them anything because they are at a phase where they could choke on anything. And if you give food because somebody comes and say, "Oh, this person is hungry," and then you give them food and they choke, you are in trouble. Not that person that was disturbing you, that this person is hungry. Okay, let's go on. Ask the family to encourage oral fluids more regularly now. Ensure subcutaneous fluids are commenced. Advise the family this is a common symptom that is unable to be resolved. Start measuring the urine outputs to diagnose dehydration. I would go with this. So, because we are not so sure of which stage of end of life this person is, that's why I would go with this one. A person over the age of 70 with a respiratory disease is encouraged to obtain which of the following immunizations? Which one could it be now? Flu vaccine. What medication is given to someone to prevent long-term disabling effects on of an acute ischemic stroke? So the answer is thrombolysis. We know what thrombolysis do. Clexane is very specific. I don't think it should be. I would say our answer is thrombolysis. When discharging an adult with an acute wound, who is the patient referred to for wound care in the community? So over here they have like different nursing team who care for different kind of thing. So we have people that are called district nurses. So what they do is they care for people with wound in their homes, like people who need some specific care in their home. So that is their own jurisdiction. And they are very good in wonders, those people are good. Oh no, they are good. I think one day I may no, I won't. Our research suggested that the majority of in hospital wait hospital research suggested that the majority of in hospital cardiac arrests were avoidable. This led to the introduction of what? Choose the correct answer. I think news. That should be news. Okay, guys. The moment we have okay, no, we have one more question. A this is me document is implemented to aid in care for which patient group? If you guys remember, we answered a question similar to this earlier. And this thing, it happens in the exam. It happens in the exam. Honestly speaking, I'm like, do they not have questions? So it happens. So this is the moment we've been waiting for. Let us see how much we got. Let's see how much we got. Oh my god, 11 incorrect. But we tried anyway. And it's funny enough that most of the ones that I flagged were were correct. Okay, let me just remove those ones that let me so we'll go through them, the ones that we did not get. So we'll get 29. And it's mostly the ones that I did not flag. Oh, okay, I flagged 42 and 45. Okay, let's review the flagged ones, guys. Oh, which of the okay, then it should be influenza then, if it is not C. diff. That means it should be influenza. Reviews great. Come on, why is the internet there? I should have known it's not influenza. Okay, so that one is correct. Then question 9 says, oh, a health visitor. Is it first aider then? So a health visitor should be a first aider. It's not a first aider. Then what? So that should be support the and I was doubting that too. I was really doubting. So that one is gone. So the correct answer, guys, is supporting the physical and emotional growth of a child. So question 11 says, ah, did I choose full blood count? I thought is I must have mistakenly chosen full blood count. Oh, I mistakenly chose full blood count. So question 13, patients with chronic pains condition are screened for which of the following? Ah, if it is not cancer, then is it coronary heart disease? No. Don't tell me it's schizophrenia, because some of them could be lying, right? No. Oh, something is on my shirt. coronary heart disease, low mood and depression. So the answer is, what's this? Okay. Patients with chronic pain conditions are screened for which of the following? The answer is low mood and depression. So, okay, okay. I think I understand now. Because some people can be depressed and it could make them feel things that is not actually there. Makes sense. So we have seven left. Ah, is 13 still incorrect? Okay. Question 22. What are you doing now? We've already. Okay, I didn't remove it. So that should be the nursing unions. So it is the responsibility of the nursing unions to lobby to the government to support nurses and make positive changes to the profession and working conditions. Yeah, that is right. So number 29 says it's not the nurse in charge, then it will be the reception. Wait, let me understand this question very well. Who will notify an emergency department that a major external emergency department? Oh, so that is the ambulance service. Yeah. So 31 says, I should have known. What has been implemented to ensure that nurses are fit to care holistically for patients with a variety of conditions? It's new registration requirements, such as this clinical practice test that we're doing right now, because it wasn't like this until 2021. I remember I almost did mine, but then they changed it. So I was one of the people who wrote these exams early on back then. So let's see, this is 31. Let's see if this is the right answer. Yes. So question 34 says, who should be notified when attending hospital with a school child age 8? So that should be the school nurse or public health community nurse team. I just hope they won't tell me it's wrong. Okay, that's the correct answer. Number 38 says, ah, a congruence in it. So, according to Rogers' theory of nursing, which of the following are described as core conditions to effective communication? That should be congruence then. Number 38, let's see. Oh, and I almost chose it, but I wasn't because I doubted the meaning of congruence. So, 42, I think you will explain that. Ah, sorry, guys. Which of the following is not considered an aerosol? What aerosol means, like producing bodily fluid, if I'm right. Let me just quickly check to be sure so that I don't give you wrong meaning. So it is any medical or care related that produces tiny airborne particles. Oh, okay. Airborne particles capable of carrying infectious agents. Okay. I said bodily fluid. That was why I chose the wrong answer. So that is sorted, and then we have one more to go. Uh, when caring for patients at the end of life, and okay, this end of life stuff. In care homes, we don't give subcutaneous fluids, but is that what they do in hospitals? If this is not the answer, then it will be C. Oh, okay. So it's subcutaneous fluids. All right, that is it, guys, and we are done. So thank you so much for watching. The person who stayed up until the very end, thank you so much. Don't forget to like, comment, and subscribe. And I think that's it for today. We'll do mental health tomorrow, same time, 6 p.m. Um, yeah, thank you. If you have any question, I'll take questions now. Any question? No question? Don't forget to subscribe to the channel. We need to hit 5,000 before the end of this year. Don't forget to subscribe, guys. See, I have lots of videos, but the views are not encouraging. You can see, let me show you my private videos. Look, look at my private videos that I haven't published yet. But it's because the views are not encouraging. So I'm like, should I put this out? No, don't put it out. No, no, people will not watch it. Oh, this video deserves more. Let me wait first. Okay, so seems that is it. Thank you so much for watching up till now. Bye bye. If there is no question.